Of Daytime Tri-Cities is sponsored by SFG Medicare. On today's Medicare Tips with Andrew, we're going to talk about the biggest health care costs that seniors face and how to protect yourself. Good morning, Andrew. How you doing?
I'm doing great.
Good to see you again. You've helped seniors all across our region. Talk to us about what is the biggest health care cost that they face right now.
So the biggest healthcare cost that a senior can face is going to be with long-term care.
Right. What is the difference between, we hear these terms all the time. What is the difference? It's pretty self-explanatory, but talk to our viewers about the difference between long-term care and short-term care.
So short-term care is what I would call your normal health care. That's, seeing your doctors, having surgeries, going to the hospital, things like that. Long-term care is basically when you can't take care of yourself anymore.
And are you necessarily talking about going into a nursing facility?
No, that's what a lot of people think is immediately they think of nursing homes. Most people don't want to go to a nursing home. They want to stay at home and get health care in their house. And so that's long-term care is basically when you can't take care of yourself. So it could be nursing homes, it could be home health care, it could be adult daycares, things like that.
If Medicare doesn't cover long-term care, what do you do?
So that's the problem, is Medicare doesn't cover it, and so you actually have to pay out of your pocket for any kind of health care like that. And so the best way to cover it is actually with like an insurance plan.
What do you help people with when it comes to this kind of planning?
So the plan that we're using the most right now is we're actually using life insurance to cover long-term care costs.
How do you use life insurance to cover that?
So they're very specialized life insurance plans, and they're great for three reasons.
Right.
One is they lock in on the price. Two is that you're guaranteed to use the benefits. And then three, it's tax-free cash benefits when you use it.
Now rates are going up. So what are some traditional long-term plans that you've used in the past?
So a traditional long-term care insurance is basically you bought a bag of money, and then when you needed that bag of money, you're able to pull out of it. The problem is those rates went up, and so people bought them in their 40s and 50s for maybe like $120 a month, which was super affordable. But when they get into their 70s and 80s, they may be $500 a month or $800 a month, and people can't afford it anymore.
Now, you also have another option for helping people with long-term care.
Yes, so it's what I would call a bridge plan. It's a plan that can cover you up to 365 days. So it can help people not with the full long-term care expenses, but give them something to help out, either to pay for a nurse in the house or for some facility care. And the best thing about that is they're really affordable. I looked at the rates for someone the other day, like a 70-year-old male, and it was only, I think, like $72 a month.
That seems like a really affordable plan for someone who's 70.
It really is. And so, a lot of people spend hundreds of dollars on the Medicare supplements, but then they don't even think about covering their long-term care at all. And
I'm glad you're here, because there's a lot of information that needs to get out there, and that's why it's important to have you around, isn't it? You answer the questions that folks have along these lines.
Well, that's what I really love about my job, is I like to take the burden off of people so they don't have to worry about that kind of stuff. That's why I really enjoy Medicare, long-term care planning, income planning. I really enjoy taking that burden off of people.
And we're going to give everybody some information right now if they want to get a hold of you. Andrew, we appreciate you stopping by. You always bring some great information to us. Medicare Tips with Andrew, talking about long-term, short-term care. I know you've got questions. He's got answers. Please give him a call at that number right there, 423-737-1865, or go to MedicareTipsWithAndrew.com. You can also find him on Facebook as well. The preceding portion of Daytime Tri-Cities was sponsored by SFG Medicare.